Hey guys, I'm alive. I did it. I explanted and I feel great. But I did want to make a video that I feel is very important of how to prepare for this explanting, breast implant explanting surgery. That's a lot to say. I will stress, pick the right surgeon. I think Dr. Buinewicz is a gem. If you are anywhere near Pennsylvania, New Jersey, because he's in both, get to him. He is incredible. But you want to feel secure with this surgeon because they're going to make the day and process better for you. You might come across some nurses or maybe an anesthesiologist that you really don't love. And, your surgeon will just make it all better. So he was out of state for me. I live in New York. My mother lives in Connecticut. So we definitely got ourselves a hotel the night before surgery. If you are in this scenario, I would do the same because your surgery is going to be in the morning and you do not want to be traveling in the morning. That's too much. That's like 3 months. That's a lot. Girl, take the stress off yourself. So you get there safely. Yeah, get there the night before. Stay the day of into the day after, I would say, because if anything should happen, I had a hematoma. No big deal, but it was a little frightening, and we were very glad that we were right there to get to the doctor's office, and I was seen, and it was fine, but it was, an experience. So that's that. Pick a caregiver. You're going to need to, or someone who definitely needs to be there for the 2-hour surgery and after. I would say definitely 24 hours. I would really like to say 2-3 days. And the day that you get your drains out, you just need someone. Now I'm lucky enough to have my mom, who is incredible. But it can be your best friend, your coworker, whoever this person is in your life. If you are not good with blood, which I am not, they should be, because the drains, we didn't get along so much, and my mom took care of it. So just know, if that's not your thing, you need someone that's good with blood. Someone that you can, I'm going to be real honest with you, that you can throw up in front of and that you can go to the bathroom in front of, because all the things might happen. You just want that person who you be a little, you be fine with. Food. So before you leave, take out the trash, clean your place, do your laundry. If you live alone, if you don't have people to be doing these things, freeze foods, stock up on all the foods you'd want when you get back. But know that after surgery, you're just going to want some real good chicken broth. I had bone broth, which was too heavy. I would suggest chicken broth, and just start there until you are sure that you are past the nausea point. Get that prescription of the nausea medication filled. I really don't think you'll need narcotics. Now, I am a person that does not like narcotics. I'm allergic. I don't like any pain medication. I had 250 milligrams of Tylenol. I took about 6 over the whole period. It was fine. But, I get it. And, monitor your own what you need. But narcotics are going to make things a little more nausea and everything too. And just, you don't want all that stuff in your system. Your system's going to be going through enough. But the nausea, yeah, I needed that because I went a little too hard with the food because I thought I was fine. And then that anesthesia she kicked right on in with her symptoms, and I was not prepared. So that was an experience. Ice. Have plenty of ice. The soft kind, the jelly-like ones, because they're just easier. Have a couple of, have 2 at least. It'll also help with the pain management. Get a wedge pillow, a travel pillow, just lots of pillows. You'll love the wedge pillow for helping to recline when you sleep, and maybe a pillow to prop you up even more. And then the travel pillow, that made sense. That was a lot. But I wanted to be upright at first, but my doctor actually, when we called him, he said it's better to be back and take the pressure off yourself, not flat. I would say flat was the third day for me. I craved it. So when you crave it, lay flat, have someone help you and guide you down and up. You'll be surprised at how much movement you have that I don't think I necessarily had when I got the implants. It was way harder and more on my, like a weight on my chest, obviously, but this, you can move a lot better. But yeah, pillows for propping yourself and under your knees when you're sleeping. You're just gonna want a lot of pillows. Have things that comfort you. My mom brought my stuffed animal from college that it made me happy. It was something nice to have. I brought my Nan's perfume that makes everything better. And I smelled that the day of surgery and just had it, to just make me feel better. You're going to want a couple of things. Meditate the week prior, the day of, and the days after, just breathe and exist and get all the clutter out of your head and any negativity. I know it's easy to think, am I going to wake up? All the things, like, you go there, but try to not, and stay as positive as you can. Trust your surgeon and just know, I got to do this to get better. This is the road to better. And yeah, I got very spiritual with it, and that's all I'll say. Just, it helped immensely. Activity, go very lightly in like the week of, I'm on day 6, and I'm still going so lightly, but I did try to go to the movies the 3rd day with my mom. And just, if you have your drains in, know that you're going to be a 90-year-old. You walk like a 90-year-old, you feel like a 90-year-old, everything 90. When you get those drains out, oh, get ready, you're a new woman, and it's amazing. So there's that. I think I went over everything. I think the only thing I didn't remember was that if you don't have someone that you feel comfortable being your caregiver, or just, you just don't have that person, there are websites, and I'll try to find some and link some below, for home care nurses. Just a thought. I know it might be an extra cost, but you're going to need it. And I can't stress that enough. So you can do this, or, if you're just thinking about it or whatever, this is going to be helpful, and I wish you well and much health. Just kidding. I forgot one thing: Band-Aids and gauze and all the things. Because the day you get your drains out, you're going to want those to protect yourself from your clothes and stuff. And that's all.